All right. Hello and welcome to everyone. My name is Dina. I am the founder of Pain to Possibilities and the Change Pain Academy, and I am your host of the Willow Tree Chronic Pain and Trauma Summit. Today, I am excited to introduce you to one of our esteemed guests, Pedro Silva. Pedro graduated from the University of Toronto in 1983 with a Bachelor of Physical and Health Education in Health and Exercise Sciences. He is a professional certified member of the National Strength and Conditioning Association, in which he is a certified strength and conditioning specialist, a professional certified member of the Canadian Society for Exercise Physiologists, as a certified clinical exercise physiologist. He's a human movement specialist, a lifestyle consultant, and accredited as an expert in the assessment and exercise prescription for special populations. He is both a certified Thai massage practitioner and a primal reflex release practitioner. In the last 40 years, Pedro's work experiences have included research director at the University of Toronto, head kinesiologist, and clinical director for a multidisciplinary chronic pain management clinic, director of fitness and program development at private fitness facilities, as well as a consultant for private physiotherapy treatment centers in the development and implementation of functional capacity assessments, ergonomic assessments, job site analysis, return to work programs, and customized rehabilitation programs. What I'm most excited about is that Pedro's work focuses on improving a quality of life in the post-trauma population, and his work is dedicated to rehabilitation and lifestyle consulting relative to chronic pain, neuromuscular, metabolic disorders, and overall athletic development for multiple sports. So, Pedro, we got lots to talk about. Today, our topic is primal reflex release for chronic pain and trauma. And I'm so excited because more people need to know about this. Not enough people know about this. So thank you so much for being here today.
Thank you for having me. I really appreciate it. I don't think a lot of people know about it. I don't think there's not a lot of exposure to this kind of approach, even though these world practitioners in the field. But it's not really advertised well. In Canada, there's only a few of us that do, more in the west part of Canada. In Ontario, there's a couple, 2 or 3 of us that do. And it's about 5 levels of learning. The experience, and I believe, I don't quote me on this, I'm one of the ones that has the highest level, including with another person, Scarborough. So we need more people to be aware of it, because it's a non-threatening approach to dealing with trauma and pain. And I think we need to tap into that system, the nervous system, that we usually don't consider or even don't take into consideration.
I agree. And that's why I'm really thankful that you're here. So, okay. Before we get into it, can you tell our listeners a little bit, just a brief synopsis of sort of how you got into this, especially the primal reflex release?
I've been in the field for 40 years. So I've been a clinical exercise physiologist for a long time, so dealing with different populations. But what always got me and continues to interest me is looking and searching for outside-the-box approaches to a more non-invasive, non-threatening way of helping people improving quality of life in the presence of trauma, post-trauma, post-pain, of chronic pain. So that always led me to try to find new ways. I came across primal reflex release techniques by chance. And when I noticed and did some more research on it, I was tremendously interested in it, because it's easy technique, it's non-threatening, but it's instantaneous response that people feel that there is a change that they probably didn't feel before, and they're actually able to use that to move forward. I think it's a bit more hope. It's not the answer to everything. I think it's wrong to say it's a miracle thing. It's not, but it's definitely a system that needs to be explored and needs to be introduced within the context of other systems as well.
Well said. Okay, so let's get into this and break it down a little bit so that our listeners really get a sense of what it is, because we could talk about this in terms that may or may not make sense to our listeners. So let's break it down. When you sent me your bio, you stated, and I love this, we're going to break this one down. Primal reflex release utilizes manual procedures that attempt to decrease undesirable effects on primal startle, withdrawals, and joint protective reflexes that often accompany nociception and pain. So we're going to break this down. Let's talk first about, can you describe to our listeners what that nociception actually means and why it's important for our listeners to understand this?
Nociception is just a technical term That is the body's encoding processing system of information coming that leads to maybe threatening to the body. That could be not just physical, could be related to anything else that our senses can encompass, from smell to touch to auditory, what you hear, all those things. That's the nociception part. And the noxious stimuli, which is stimulus that comes from different tissues in the body that also perceive some sort of threat. And that creates a change at the brain level. I think what we have to understand is that the brain is the center of processing information. Emotion, memories, physical threats all come to the brain. The way they are processed influences our recovery from injury and trauma. I think we need to bring that brain component into the aspect as a primary source of dealing with chronic pain and trauma.
Absolutely. 2000%. I love this message so far. This is great. Okay. So continuing on that theme, just can you describe what primal startle is? Am I getting that right?
Primal reflexes are reflexes that are developed in the womb. So this is before birth. And the primary reflexes we deal with in primary reflex releases are probably the two most important ones when it comes to trauma. Not to neglect all the other reflexes. It's called the withdrawal reflex and the startle reflex. And the best way to explain is startle when we get started with something. It could be a voice, a touch, don't touch me, all this kind of information as an effect reflex. Withdrawal reflex used to be known as the flexor reflex, but it changed it in systems of pain is now recognized as nociceptive because it has more than just you're drawing from something. So it's more of a physical response. If I put my hand on the burner, I withdraw, that is a withdrawal reflex, but it's more than that. So those two primary reflexes stay with us. It used to be believed as an infant, in an infant withdrawal reflex called the motor reflex. And usually by 3 to 4 months, it's gone, but it's not necessarily gone. We have these systems implanted in us to protect us from danger. And that becomes the part of primary reflex releases. With trauma, these reflexes are heightened. And without the resolution of trauma being that emotional, physical, they will continue to be heightened. And that affects all the body systems in the body. From the respiratory, circulatory, and so forth. And that's why I think when we tap into reflexes, it has a cascade of physiological events that happens at a multi-system level. And allows us to move forward a little more. So using this as a tool, it may progress further the management of pain and trauma.
Right. Oh, fantastic. Okay, so there's lots of good tidbits in there, or at least lots of good information in there. For those who are listening who have never really heard any of this before, if they are really been taught only sort of the biomedical approach, this might be all new to you, but we're going to try to keep it high level so that it's understandable. Okay, so for our listeners, what does a primal reflexive release treatment look like?
Well, a primary reflex release treatment is simple. It's actually in a very non-threatening environment. The person is fully clothed. I like people lying down on tables so they're a bit more relaxed. They don't have to, but I like that. In primary reflex release, we use what you call scan system. There's one's called the 1 minute nociceptive exam. And before I explain what that is, it's a system created by John Himes. This is the creator of primary reflex release from San Diego. He's now in Arizona, obviously, but because he's semi-retired. But what he noticed is that in people with chronic pain in a hyperreflex response, there is these specific areas in the body that are hyperalgesic. They are very, very sensitive to touch. And he was able to develop to figure out what some of these patterns were. And based on those patterns, he created different kind of exams that we can just by touch alone, it creates a response in a person, a grimace, a groan, a sigh. All these things are physiological responses to a reflex. And when those are hyper, we can guide us on what we should be treating first. And sometimes it's nothing to do with joints and movement. It has to do more to reflex and how the pain is affected the visual from a memory and cognitive standpoint. So that's very, very simple. It's non-invasive. Yeah. It's just by touch. So we don't use like trigger point technique where you pressure and there's no spray and stretch. It's primarily the feel, the rubbing of different parts of the body that creates that response. And that a lot of the primary reflex release, 6 of them are primarily on the cranium. So that affects everything else in the body. And by down regulating that, the person has this automatic response to the physical change in the body. The pain is less, they can move better, they can breathe better, and that just opens the gates to a better recovery and dealing with the issue at hand.
So there's some really cool points coming out of what you just said there. And I think one of the most important parts, and we'll touch on it a little bit more in a moment, is the safety aspect. So not only the safety of how you are sort of what your environment is and where the treatment actually occurs, but the safety in touch and the safety in, not much pressure and also just understanding where it all comes from. The fact that most of the triggers are in the head speaks so much to how involved the brain actually is, right?
Correct.
Anyway, I'm sorry, I'm getting a little off topic because this is very exciting.
That's good. That's clarification. I like that.
Okay. So with treatment, what sorts of things are you seeing as a result of treatment? What sort of a couple of points that come to mind that you are really excited about seeing coming from treatment?
I think the most response people get it. Now, once again, nothing is 100%, but the most response I get, and I've had a few cases I can mention where people have come to me with severe pain after 3, 4, 5 years, and they've gone through the process of dealing with the physiological aspect of pain. But what I always ask is this: when everything else is not responding, is it not time to look into something that may be holding us back? And reflexive seems to be that pattern. So when I do reflexive treatment, it's an automatic response. It's an instantaneous response to something that they feel better. And the first response is say, there's no way you're pressing the same way. It says, I'm touching the same way. So it's this response, wow, I don't feel that pain. I don't feel as discomfort anymore. I can do better. It's a clarity aspect of things. They report instantaneously post-session. And sometimes what I do, I take advantage of that clarity and I use my Thai massage, because I'm a Thai massage practitioner, which is based on acupressure and movement, to enhance that further. So we can both reflex and the physiological aspect of it to create the maximum amount of effect and response. With primary reflex release treatments, it's like everything else. We say, and John Himes always told us this, the creator of this, 4, no more. If the person after 4 treatments is not creating the response reflexive wise, it's not because it's the wrong approach. It's not probably right at this time. We need to address other things. And I think the message to here, I think being in the field for 40 years, is that in the rehabilitation of pain and trauma, we seem to focus on a very, very systematic approach to physiological change only. And I think we need to look into the multifaceted system involved in trauma and chronic pain.
Right.
That should not be neglected. And if I may mention, I have a list I actually wrote for you because I didn't want to forget to mention.
Yes.
Dr. Perry Nicholson, which is Stop Chasing Pain in New Jersey, is a person I follow for years and a tremendous researcher in chronic pain. And he was the one that first presented to me the body ecosystem hierarchy. And what he said is that we seem to be working backwards. And what he said to me, says the most successful thing is work the brain, the lymphatic system, the gut, the nerves, the organs, the endocrine system, the musculoskeletal system, and the local imagery. If you notice the local, to treat the injury itself, that's the last thing we should be looking at.
Yes.
Not to say that there's no injury there, but I think we have to start at the top of everything else that controls everything else in the body, and then work ourselves out from there.
Right.
So in primary reflex release, we have a technique that we call lymphatic priming. So we evoke reflex with lymphatic system, and that creates further quicker response to any treatment. So these are just techniques that, when put together sometimes, is trying to find what's the right recipe or cocktail for that patient. I'm always very careful. This is not a cookie cutter approach. Everyone asks me, where do you go? Where my hands lead? Where my patient tells me to go. There's no specific protocols. The idea is to find out where the reflexes are and where they hyper, and then work with them that way. So it's very non-threatening. It's very calm, very relaxed in a certain way, and they usually come out with that response that it feels different, or I can move better.
Amazing.
I had an example of somebody who's a physiotherapist actually, and she's retired. She's had hip pain for a long time. Obviously, her pathology has been completely resolved, but constant pain all the time. And she says, Peter, I'm just getting older. He says, okay, well, do you want to try this? And I just give a nice 20, 30 minutes of primary reflex. He says, what is going on here? He says, I don't know, you tell me.
Mm-hmm.
She was able to go home and call me at night and says, I have no pain in my hip and I slept well.
Mm.
So it tells us it's not a miracle thing. Once again, it's maybe something we need to tap into that puts systems more in balance and allows us to change other systems, nutrition,
right,
the prime system, and so forth.
Oh, I love that, because I am a huge believer that we need to be able to support the systems, because there are many systems involved in chronic pain, chronic illness, to be able to serve itself, right? And yeah, that's a well said. So you did touch a little bit on it earlier, but is there a time at all when perhaps primal reflex release is not ideal?
To my knowledge, I've been practicing for quite a while now. There's been not really. And I think a lot of times the concern when there is deep emotional stress involved with the injury or the trauma, primal reflex release techniques works really well with energy psychology, such as the EFT, which is the emotional focused therapy component. And the interesting thing is that in EFT, the acupressure points, we use the same thing in Thai massage. So it's just tapping technique. So it's the same very gentle approach to it. There's a technique we use in primal reflex called the startless reflex, where we actually try to bring people to do the opposite of the startle response and bring them back gradually to the emotional component of the trauma. And by doing the reflex, the physiological reflex release, they actually feel better. So there's no threatening to it. There's no adverse effects from primal reflex release. It either works or it doesn't work, or there's change, but there's no threatening adverse effects to the client or the patient. So it's pretty safe.
Yeah.
And people might as well try it.
Right, right.
Why not?
Yeah, absolutely. Well, that's what I think is fantastic about it, is that, like you said before as well, the 4 sessions, you're giving them, hey, if this is not working, perhaps it's not the right time. So that is not often what is experienced inside the chronic pain community, right? They're often told you keep coming back, or you're going to multiple appointments. So that's refreshing. Absolutely. You also touched on earlier, and I think it's a really important part for our listeners to understand, is that chronic pain is absolutely a sensitized nervous system, right? And so, so when it comes to the reflex release, how is it impacting the nervous system as far as calming things?
Well, with reflex release is simultaneous. One of the things that we look at pain and reflexes is that they are subconscious. So because being subconscious, when you create a reflex release, there's an instantaneous response in the body that lets the nervous system calms down. So in simple words, without going too much technical, primarily people, when they are in a trauma and chronic pain, they are more in a hyper state of sympathetic drive, always an overdrive. And even without trauma, we don't think, but constant bad news, stress at work, we're overdrive all the time. What the reflex release do, we try to balance that by stimulating the other system, which is a recovery system, which is called the parasympathetic system.
Right.
So we try to balance that, and by doing so, the body's recovery is much better. So we try to change the medium or the environment for the body to be receptive to reach homeostasis and balance that we need.
Right.
That's how the reflexes work. And all the reflex techniques, people most of the times have their eyes closed because I don't want them to see it. I want to create a reflex. They ask me, why are my eyes closed? Well, if you see me doing it, it's no longer a reflex.
Right. Oh, okay. So a couple of key points there. Yeah, just for our listeners to make sure that they're really, really absorbing this. The coming out of that fight or flight, like chronic pain, unfortunately means that you are in that hypervigilant state, always in that fight or flight response. So any chance we have to get out of that, and that's what a lot of the reflexive sessions are doing.
I'll give you some food for thought. We always look at fight, flight, and freeze. And if you look at the polyvagal theory, and it's very strong in stimulating the vagus nerve. In reflex release, we try to stimulate the vagus nerve because we call John Himes calls it the lost vagus. The vagus nerve is an understimulation vagus nerve, which is the most important nerve to recover our body.
Right.
So polyvagal theory approaches are very powerful post-reflex. So these all intermingle, in fact, when we see these techniques. Much more coming from the brain response. But what I meant to say is that in reflex, we look at fight, flight, freeze, and John Himes has frustration. And the frustration part is where the primal reflex release come in, when people have tried everything else and say, okay, let's try to slow down the body. Let's create an instantaneous reflex response to get the body to move forward a little bit faster. That's all.
Okay, fantastic. And I do remember what I was going to ask you. It was, when it comes to certain behaviors that happen as a result of chronic pain, the bracing, the, tight, soft tissues, just because of that constant state of fight or flight or freeze, or frustration. Do you feel like the work that you're doing is really helping to sort of change those behaviors? So once they can come out of that fight or flight response, some of those behaviors start to shift?
They do shift actually instantaneously in a certain way.
Okay.
That constant instantaneous physiologic cascade of events that happen post-session already gives gate opening opportunity for them to sense the change, which leads to change of behavior and hope.
Right.
And I think a lot of times it's just to give people a little hope of a better quality of life,
right,
and more enjoyment of things is sometimes a step forward. I give you an example. I did reflex release to a lady who was going to surgery, and she didn't want to. She's fairly young, and from a neurological standpoint, it showed that maybe, but she wanted to take a different route. She came and explore primary flex, and she couldn't sit down, she couldn't drive. In about 3 treatments, she was able to drive, she was able to walk. And primarily is that she has to do a homework as well. So these certain things that people need to understand, and these primary flex exercises we give to people, so they can have that nice little cocktail or recipe that gives them confidence that it's okay, that allows them to move forward. And as over a year ago, she has had no pain for the last 12, 14 months. And she's enjoying life. She does a routine every time. Of course, she does. The structural changes she has to address. But she's functional and she's enjoying life. The quality is better. So we need to be careful into it, but we make sure that people also that what we do is change an environment. They still need to put the work in it. The behavioral change comes along by that belief system alone.
Absolutely. And I think another important point, and gosh, we could talk for hours, but is it's important for people to understand that they do have some control over it. We're so used to the sort of passive approach, right? So it will take a little bit of effort. It will take some time. However, how incredible is that when you have that power to be able to make that shift yourself, right? And I think that's
I think we need to stop overpowering people, but we need to empower people. I think we need to educate people the fact that we have this amazing body with so many systems that we got to give it a chance. We have the innate ability to do so.
Right.
When we go to different therapists, they're just trying to stimulate that innate ability to do so and be open to that. So open mind approach may actually be a step forward to moving to anything else you can try.
Oh, well said. Yes, because belief systems are actually a part of the whole chronic pain experience too, right? If you don't believe that something's going to help you, then
nothing will.
Right.
Usually nothing usually does. I think being open-minded does not mean you believe everything, but I think you need to understand that you do have a body that's powerful.
Right.
And we don't need to rely on external factors or external mediums to always get better. We need to, and these systems are so interactive. Our behaviors come from that interaction. So we need to address that.
Absolutely. So there is hope, there is power, and you have an amazing, amazing system, and it can work towards recovery. I think that's really important.
Exactly.
Okay, fantastic. Now, before I let you go, a couple of things. Is there one little nugget that you would like to leave our listeners with, just based on the experiences you've had with treatment to the expertise you have? Is there one nugget that you think that you might want to share with our listeners today?
There is one thing that is one of the most important things in life is breath. And we don't realize that even startle or withdrawal reflexes, one of the things that usually gets us is our diaphragm. Our primary breathing muscle gets affected.
Right.
One of the nuggets I tell people is that if we can enjoy and learn good breathing, you're already stimulating so much cascading events to healing and well-being that you'd be surprised. So the nugget is that try to breathe properly, try to slow down. Breath slows down the nervous system. That's your first to go to. As a matter of fact, when I do primary reflex releases, I reflex release the diaphragm.
Right.
And I'm going to give you a little thing, Pearl, for everyone who will be listening.
Perfect.
If you're sitting at the chair, nice and relaxed, arms to the side, and you turn your head as far to the left as you can, and you cough 4 times, reaching with the right hand. and then you throw it to the right, and then with the left hand, reach 4 times without moving your rib cage. That's a reflex release for your diaphragm.
Ah, amazing.
Throws everything down. And the other thing is that diaphragm fibers, from a physiologic standpoint, go all the way to the clavicle and the first rib, as well as they go to the flexor muscles of the hip. Mm-hmm. By releasing the diaphragm alone, that muscle that holds you back by breathing problem, by startle, by pain, by fear.
Right.
A lot of things start working just by doing that alone. That's why it's so perfect.
Okay, 2 things there. Thank you. First of all, yes, and I know that our chronic pain community gets a little tired of hearing the breathing message. However, what's really important, just like you explained so eloquently, is that the breath has an immediate response. And I think that's what's important for people to understand, is that we're not just doing this to suggesting breathing because we think it's fandango and all the new crave. It is physiologically going to make an impact right away. The second thing is you can do it at home. So could you please just talk us through that one more time, the little homework that they can do, that little reflex for the diaphragm?
So you can do the diaphragm release. You can do it lying down. I like when people are in low pain, if they lie down and more relaxed for some reason. People are sitting down, they'll find a comfortable position. You can do it in both positions.
Okay.
And the thing is to be in a relaxed position, arms are on the side. So if you're lying down, like a corpse position in yoga, you lie down, you relax, you close your eyes, and you turn your head within comfort. You don't force anything. As far to the left or the right. Let's say you go to the left first.
Okay.
And you cough 4 times and cough hard. You reach with the right hand down. Don't lift the arm, just reach down 4 times.
Okay.
Then you gently turn to the opposite side and cough 4 times and reach down with your left arm. Reaching, if you're lying down, reach down to your feet, but don't lift your arm. Just slide it on the mat. Okay. And once you do that and you take a deep breath, you will notice automatically the difference. So people want to experience the difference. What I would suggest them to do, take a deep breath, see how the body feels. Do the diaphragmatic release, and you'll notice a much better expansion of everything around, not just the body, everything. The whole cylinder expands. Right. Now the body's welcoming something. Now you're less stressed. The body's welcome to change.
Fantastic. And arguably, the diaphragm might be one of the most important muscles in the body, because if it's not working right, we're not breathing. So
it's true, and it affects everything else. It affects movement. It affects low back pain. It affects hip pain.
Right.
The fascia components of the diaphragm go as far down hip flexors,
the
lumbar vertebrae, the lower back vertebrae, upper vertebrae, cervical fascia, clavicle, and first rib. Right. And if we can just release that, everything that gets involved takes a break.
Right.
I can move my neck. And you'd be surprised how much better you move by just releasing the diaphragm.
Beautiful.
So there are things that people can start with. Just breathe better. Surprised.
Yeah, fantastic. And for our listeners, just so they know, the fascia that Pedro was talking about is, if you were to peel an orange and you see the white layer that sort of connects all the pieces together, that is like your fascia. So it's a pretty incredible tissue, connective tissue, and it serves its purpose. Pedro, before we go, tell us a little bit about what your free offer is, and also how they can get a hold of you to take advantage of that.
Free offer is a full assessment and treatment with primary reflex. So we'll go over through the whole process of assessing, see what your reflexes are, and then complement that with a nice Thai massage, which is massage typical, fully clothed on a mat, which involves gentle acupressure and movement. So I call that the lazy person's yoga. Okay? So it's very gentle, very approachable, but I usually try to combine. That's what the session would entail. And then we'll go from there.
And it's in person, right? You cannot do this virtually. Yeah. Okay. So for our people around the world, I apologize. It's hard to find, but if you're in the area, you can. How would they find you?
The best way to do it is to connect with me through text, and my phone number is 416-880-7148. I think, Deanna, you can put my my email on site, but I've got to confess, I'm not good with emails.
Okay.
I'm good at texts. Yeah. So if you try to get in touch with me directly, you will get a response in 24 hours. So that's for sure. If you do text, that'll be much better.
Amazing. Well, Boy, there's so much to talk about, but I'm really hoping we just, kind of scratch the surface so people get an understanding of this treatment and how it can work, how it can benefit them. That's really the place to start from. And these conversations are always really important. So Pedro, thank you so much for being here and for spending time with me today.
Thank you so much for having me and for allowing me to express and maybe put out there another approach to management, or a conjunction approach to other management approaches as well.
Well said.
Thank you.
Thank you so much. I really appreciate it.